This is a presentation that I gave at the International Symposium on Canine and Feline Reproduction. I was conscious that I was speaking about fertility control to an audience that is more commonly engaged in supporting dog and cat reproduction, but I know that that irony was short-lived. I know that we all agree that what we want is management of reproduction so that births are wanted and supported for the best possible outcomes, and those that are unwanted and unlikely to be successful are prevented. My presentation is focused on the Global South, sharing some of the needs and solutions to dog and cat population management there, and then also dwelling on the challenges of fertility control in such environments and why I'm such a passionate believer in the power of non-surgicals to change this game for the better. So I'm speaking from my field experience for working for international animal welfare NGOs, and also from my ACC and D perspective of how an innovation could change that field, following on from the exciting talks from David Pepin, Lindsay Van Zandt, Thomas Conlon, Linda Rhodes, all at the same conference, and why what they and colleagues have been working on matters so much. Where there is no active management of dog and cat populations, their numbers will be limited through mortality, mostly driven by the availability of resources such as food and shelter, but also the tolerance of local people, who, when pushed too far, will take matters into their own hands and actively kill animals they perceive to be a nuisance or dangerous, or limit access to their resources further to decrease their survival. Mortality rates obviously vary widely between countries, but just as an example, in India, roaming dog mortality rates in the first year of life have been estimated to be 75% and 82% in two different urban areas. And for feral dogs living outside human settlements, this increases to effectively 100% mortality, as they appear to be unable to sustain their populations, relying instead on constant immigration to maintain numbers or simply dying out. Cats do a little better as ferals, but not because their mortality is especially lower, more because they have a greater breeding capacity. So they do seem able to sustain a feral population, although such populations are relatively rare compared to the classic street cat population living off a combination of predation and purposeful human handouts. Even these populations, receiving some kind of regular care, have high mortality. Felicia Nutter's close observation of urban cat colonies estimated 75% mortality in the first 6 months of life. Such high mortality is obviously not a pleasant sight, and local people can become very disturbed by the sight of suffering animals, and quite violent conflicts can occur between people on opposing sides of the debate about whether to kill or protect roaming dogs and cats. But then we can swing from unmanaged to cruelly managed populations. So here we have authorities driven by demands of local citizens trying to do something. And this is most commonly targeted towards dogs rather than cats, as dogs tend to be inspiring the greatest number of nuisance complaints, and the threat of rabies is ever present with dogs and a lesser issue with cats, who present less of a rabies transmission risk. And while some people see this as a necessary evil, many more find this kind of management as distressing as seeing animals dying on the streets. So we have mass culling using poison baits or injectable agents following cruel methods of capture. But actually, I believe mass culls like this have actually reduced in frequency over the past decade, and I think that is mostly due to the pressure from local citizens against such actions, as much as from any protest from international organisations. Although on the right we have a photo from Australia where feral cat culling using poisons such as 1080 are still being used. But then we also have the shelter solution, where large numbers of stray dogs or cats are caught and brought to a shelter site. And these are unlike shelters we may be used to visiting in Europe and the US. We are talking high density group housing, many hundreds if not thousands, with very little if any chance of rehoming. High rates of mortality due to disease transmission, neglect and direct aggression between animals, and I believe that this is a response that is unfortunately on the rise. I just wanted to dwell for a moment on the issue of rabies, because when we see cruel control in action, it's often incredibly hard to comprehend why someone would behave like that. But I think it's worth walking a mile in their shoes and finding some level of understanding from which you can build an agreed way forwards by recognising and addressing the fears that can lead to this kind of response. So rabies is still the most deadly disease in the world. Once symptoms start, you have no chance of recovery. Estimates of deaths stand at 59,000 per year, most of which happen in Africa and Asia, and nearly all of those result from transmission via a dog bite. It's worth noting that very few of those deaths are reported. One of the reasons is because people may not take their family members to the hospital. They know that they're going to die, they know the cost of treatment, and so they keep them at home. And the symptoms the victims experience can be really unpleasant. And even though the total number of deaths is relatively low compared to those from malaria or even COVID, 5.5 billion people live at daily risk of rabies. And that risk can be terrifying. A bite from a symptomatic rabid dog is a frightening experience. And the cost of bite treatment can be debilitating in those countries where healthcare is not for free. So some people take the risk and don't pay for bite treatment, and then they have many weeks or months of anxiety about whether they have done the right thing. Some parents have to decide whether to take that risk on behalf of their children, and that's not a position you want to be in when money for healthcare is extremely limited. Conversely, are many great things about rabies. We have an affordable and highly efficacious vaccine against this virus. We have a reassuringly low R0, just 1.2, so on average each rabid dog infects just 1.2 other dogs, and this means the proportion of the population that needs to be immune for effective rabies control and elimination is actually only 20 to 45%, dependent on local R0 values. Now, because rabies vaccination campaigns tend to be run annually and the dog population turns over in the intervening months, with vaccinated dogs dying and unvaccinated pups born, the target for an annual campaign is usually 70%, ensuring that herd immunity won't fall below critical levels before the next campaign. And this is why 0 by 30, which is an end to human deaths through canine rabies by 2030, has been championed by the WHO, FAO and WOA, previously known as OIE. But the challenge is that those dogs that matter most to rabies transmission, those that roam, are paradoxically the least likely to be vaccinated. Dogs that are owned and confined and under close supervision are brought to vaccination campaigns every year. But it is the roaming community dog that no one bothers to vaccinate that clearly has the greatest contact rates with other dogs and humans. Also, in some countries, the turnover rates are really high, so even 70% vaccination may not be high enough to keep herd immunity above critical levels in some years. And so dog population management, or DPM, has an important contribution to make to rabies control, to bring those community dogs under guardianship and reduce the production of unwanted dogs that are likely to be abandoned and left unvaccinated, and also to reduce the turnover rate to help keep vaccinated dogs alive and reduce birth rates. So what does dog and cat population management look like? Well, at the International Companion Animal Management Coalition, or ICAM, which is the organisation I work for, we present dog and cat population management as a system of services. I'm going to use the dog population management system here as the example. This infographic shows the elements of that DPM system, but the same is required for cat population management. At the base are the foundations that provide the legal basis, political and social will for DPM. Together, these ensure you can sustain these services and adapt them over time. At the top are the services, the on-the-ground actions that are designed to influence demographic processes and in the dog population and the human behaviours that drive those processes, such as allowing a dog to roam, abandonment, adoption, and control or not over births. These top services are fundamental. They are critical to have in place in all effective DPM systems. Although locations will vary in their dog population dynamics, there are some processes that will always need to be managed. Reproduction needs to be managed to avoid unwanted litters, and veterinary care needs to be accessible so that dogs both enjoy good welfare and present minimal risk to other dogs, animals and people, and this includes preventing and treating zoonotic diseases. This requires people to behave responsibly in accessing services for their dogs and for those services to be delivered by capable professionals. All these services require the full engagement of veterinary professionals. The inner ring of services are those context-dependent services that can be just as influential on the dog population dynamics as fundamental services, but this will not be the case in every location. They will become important when and where population dynamics, ownership practices, and enforcement systems can support them. This includes services like identification and registration. Introduce this too early and hardly anyone bothers to get their animal identified, microchip readers aren't available, accessing the database is cumbersome, and hardly any lost animals are reunited, and the whole thing becomes a bit pointless. So initially, especially when resources are limited, we encourage people to focus on those fundamentals. And for this presentation, we're going back to the fundamental service of reproduction control. And it's this that I want to look at in more detail, and in particular, how we might try to deliver these services and to which animals. And it's the population demography and dynamics that dictates that. So this is a simplified diagram of dog population dynamics, and here is all the breeding. In many countries on the African continent, Tanzania, Kenya, Malawi and so on, and also in many countries in Latin America, such as Peru, Mexico and Brazil, these dogs make up the majority of the dogs on the streets. They have an owner, but confinement of dogs is not the usual practice, not dissimilar to how Europeans keep pet cats. And so those dogs that you see roaming on the street often do have a referral household and an owner that has both a right and a responsibility to engage in reproduction control. And so in those countries, reproduction control should be primarily delivered through owner-directed programs where consent is sought for sterilisation and services are paid for, although they may need to be performed at low cost or subsidised. Now, in a country like India, Nepal or Thailand, you have those owned roaming dogs, but you also have plenty of these community dogs. They have no single owner, but plenty of people show compassion by feeding these dogs on a regular basis, and so their breeding can be quite successful. So what do we do with these? Well, that's where catch, neuter and return for dogs or trap, neuter and return for cats can play an important role. I'm conscious I've been talking about dogs a lot in the last few slides, so just to bring cats back into the picture. International Cat Care described cats as being on a lifestyle spectrum. Now, all the cats here can be seen on the street in varying proportions. Where I live in rural UK, there are plenty of cats visible on the streets. The vast majority are pet cats, with a few in-betweeners. Now that's a term that iCatCare have coined, and it describes a cat that is owned but doesn't really behave as a pet. It's not adapted to living on the street. It's still very dependent on its owners for food and shelter, but they're also not really well adapted to living in a normal domestic household. They are fearful and stressed when confined in close proximity with people. I think we all know cats like this, and I'm grateful now to have a term for them, the in-betweener. iCatCare has also recently published a cat-friendly decision-making document on potential solutions for such in-betweener cats. Where I work, in urban areas of the Global South, street cats predominate, with some feral cats on the outskirts of urban areas. So we know reproduction control is important for all these cats, but how we deliver that depends on accessibility and ownership. If we have owners, then reproduction services must be owner-directed, consented, and ideally also paid for. But for those unowned cats, we may be looking at TNR. Trap, or catch, neuter, and then return, can and is used for both cats and dogs in many communities around the world where such roaming animals are tolerated but unowned. The process with community cats and dogs is very similar, with a few noticeable differences. With cats, often you or a feeder will trap a cat. With dogs, you can usually catch them by hand, hence the difference in the usual terms, with TNR used for cats and CNVR for dogs. Sterilisation is currently nearly always surgical for both, but I'll talk later about why I hope so deeply that this won't always be the case. The photo on the right is from a field clinic in Bangkok, where Soy Dog Foundation are currently running a CNVR project. While anaesthetised, there is an opportunity to both mark and vaccinate. You'll see the clear ear tip on the left ear of the cat. In dogs, people often use ear notches or tags. And then post-recovery, they are returned to the point of capture, ideally straight back into the care of their community guardians. There are a few ways to maximise the effectiveness and sustainability of TNR and CNVR. The first is community engagement and actual action to support the intervention. So it can be argued that as these communities are maintaining these populations through their kindness, including feeding, they also have some responsibility to manage their reproduction. People can be tasked with identifying the numbers of community animals in need of sterilisation in their neighbourhood, then to help with locating and trapping or catching them, then returning them to a safe area close to where they were caught and providing some post-operative oversight, highlighting any apparent concerns. But this engagement can also become longer term. In this photo taken in Kathmandu, Nepal, we see a member of the community helping the NGO vet team to revaccinate community dogs that were sterilised and vaccinated a year previously. This particular project, called Manamitra, went an extra step and formalised this community role, working with local government offices to identify willing volunteers in the community to be animal management assistants, or AMAs, giving them training, identity cards and a clear role in supporting their community, which is highly valued in Nepali culture. So people like this lady here are an active and ongoing driver of the project in her local community. She works with the local government office to resolve concerns or complaints about dogs. She helps with annual vaccination campaigns, and she keeps an eye out for new dogs arriving in her community so she can help get them sterilised with the help from the local NGO. This next factor for success was distilled using a computer simulation of a cat population. This model was developed by Phil Miller at NWRC in the US in collaboration with ACC&D and in particular with one of our trustees, John Boone. They use this model to test different management scenarios, including culling and TNR using surgical sterilisation or a non-surgical contraceptive. They were tested in terms of their impact on cat numbers, preventable deaths of kittens and adults, and also cost. This model has produced many interesting findings, which are neatly summarised in this guidance document, which also provides links to 3 peer-reviewed publications relating to this model. One of the findings was that the intensity of the effort really matters. Now that may seem obvious, the more TNR you do, the fewer cats you end up with. But how about if you take the same number of sterilisations and then either do as many as possible in the first 6 months, followed by a handful over subsequent years as a kind of maintenance, or spread the same number of sterilisations evenly across a 10-year period? Well, the outcome is quite starkly different. With a front-loaded effort, you get a 50% reduction in population size, but an even spread of the same number of sterilisations gains you only 20% reduction. Because if you spread your sterilisation effort evenly, there are a whole bunch more females born in the early years with the capacity to produce kittens, whilst if you front-load your effort, those females are never born. John, Phil and colleagues have expressed this as a cost efficiency index in the last column of the table. This is the cost required in dollars to drop the population size by 1 cat from starting to final abundance after 10 years. And we can see that slow and steady does not only win the race in terms of cat numbers, it also costs you a lot more in the process. But it's interesting to ask, what does this front loading actually look like in practice? Well, one approach is to boost veterinary capacity for a short period and do what is being called a spayathon. And here is just one example, although it's a particularly large one, where HSUS has conducted several years of intensive spayathons in different areas of Puerto Rico. This involves several organisations donating a large amount of veterinary capacity for just a few weeks. This results in a high throughput in a short space of time. I believe the highest was nearly 9,000 dog and cat sterilisations in May 2019. So this is a temporary expansion of veterinary capacity, but it does involve strong local engagement and capacity building for the full veterinary process, including both local vets, vet techs and community engagement people, ensuring they can continue to provide sterilisation services at a maintenance level following or between spayathons. Importantly, this is not just TNR and CMVR. In Puerto Rico, this was majority sterilisation of owned animals. And that attention to owned animals is really important because these populations of community and unowned dogs and cats are not isolated. They are experiencing constant immigration from the owned population and exchange with surrounding areas. This graph is also an output from the cat population model, and it is showing how increasing levels of immigration can really undermine reductions in cat populations undergoing TNR. So we can see here at low immigration of 2% from the surrounding areas and from homes, you can get a good reduction in cat population numbers after 6 years or so of TNR. But where immigration is high, here at 12%, you can see a limited reduction in cat numbers, probably too little reduction to be noticeable to the local community, and so risking a perceived failure of TNR. And here we have an example from a dog CNVR project. Before the intensive CNVR effort, we have sterilisation levels of around 45% of the free roaming dog population, measured using street surveys, jumping to 96% after the CNVR project has done its work. The teams then go and work somewhere else and come back on average 16 months later and find the sterilisation coverage has fallen down to 65%. This is a loss of about 25% sterilisation and vaccination coverage per year. And this is driven both by mortality of sterilised dogs, but also immigration of unsterilised dogs, presumed to be mostly due to abandonment of unwanted dogs from homes. So just to hark back to a CNVR project I mentioned earlier, the Manamicha project in Kathmandu, Nepal, they also provided sterilisation services to owned animals using field clinics to try and mitigate just this kind of immigration and undermining of their CNVR efforts. So I now want to dwell a bit on the costs and sustainability of this work. Many years ago, I worked with a local NGO in Colombo, Sri Lanka, called the Blue Paw Trust. We set up with the local municipality a fully comprehensive DPM project. We had vet training, CNVR, owned dog sterilisation, community engagement, education, mass vaccination, and some innovative M&E efforts, and it was all very successful. However, when I look back at the budget for this project, in the first year, the international NGO that I worked for at the time spent 72% of their grant money on surgical sterilisation. So although this was highly successful in terms of its targeted impacts for animal and human health, for example, we dropped the rabies cases down to almost zero and saw the end of mass culling of stray dogs using exhaust fumes from car engines, it was essentially unsustainable for this community. And then when we look at cat population management, and for example, Australia's current feral cat culling ambitions, we ask ourselves whether cat TNR could be an alternative, and in theory it could, yes. It has as much chance of succeeding in its goals as mass culling does, but the financial and logistical costs of all those surgical sterilisations would obviously be high. Now here are some of the barriers to surgical sterilisation, particularly acute in the global south, although I'm not necessarily including Australia there. We have issues of veterinary capacity, not enough vets working in small animals as opposed to large animals, and not enough of those small animal vets with the necessary training in good surgical techniques. I took this photo in Kenya, and this is clearly a long way away from an aseptic technique. This particular vet paused his surgery at one point to answer a text message before going straight back on with the spay. And so many NGOs spend a lot of money and time on training. These are photos from Humane Society International Vet Training in Bolivia and in Bhutan. And that training has many benefits beyond only surgical sterilisation. The general boost to surgical ability is a positive step, but it's time-consuming and expensive. And then we have the issue of veterinary drugs and materials, which can simply be unavailable in some countries or have very inconsistent supply and prices. The time required for both the actual surgery and post-surgical recovery can be many hours or even days in the case of a difficult recovery, and all of this adds up to the high costs that I experienced in our Colombo project. And so when we heard at the symposium about the potential advent of a non-surgical fertility control, this was obviously really exciting news for those of us that work in these resource and capacity limited communities, because we can see the game-changing ability of such an innovation. If we look globally, the estimates for dog and cat numbers do vary, but they are somewhere in the region of 700 million dogs and 600 million cats. And most of these will be roaming freely for at least part of the day and therefore have the potential to get pregnant. We don't have the ambition to sterilise every dog and cat. Our goal is not to make their species extinct, but we do want to bring all of them under some kind of care or management to minimise risks and maximise welfare, with reproduction control available if that is what is required. So if we now look at the global population of small animal vets, The WSAVA is a worldwide association of national small animal veterinary associations, and those national associations represent 200,000 vets that provide small animal veterinary services. Now, we know not everyone joins their national association, so we could estimate the total number of small animal practitioners to be double that, around 400,000. Compared to the number of dogs and cats in the world, that is a ratio of 3,250 animals to each vet. Now, we know the distribution of both animals and vets is not homogeneous. It will be far better in some countries, and that ratio will be far worse in others. I worked in Sierra Leone many years ago, which at the time had just one vet in the whole country who could spay a dog. But suffice to say, we just do not have the veterinary capacity to surgically spay and castrate all the dogs and cats whose breeding is unwanted. But non-surgicals give us the ability to use the available time of vets much more efficiently, and potentially could also be used by veterinary technicians under the supervision of a vet. Let's now look back to the challenge of rabies control. This is an image from the Serengeti where mass vaccination has been used to reach these dogs. Note the green paint marks on their backs. Now, these are all owned dogs, and the puppies of some of these dogs will be wanted. In fact, they will be very valuable, but not all of them. And this owner has no access to sterilisation services for his dogs, so he's quite likely to end up with dogs he doesn't want, which may then end up being abandoned and unvaccinated. Surviving in this environment can also be quite challenging for dogs, especially for a breeding female, so mortality and population turnover is high. All this drives herd immunity down following a vaccination campaign like this, and that allows the rabies virus to continue circulating. An ideal scenario would be to be able to offer this owner a non-surgical sterilant for his dog at the same time as he's getting his dogs vaccinated. Although I want to be very clear that these should be two very distinct injections. A combination of rabies and a non-surgical sterilant has a far greater potential for abuse and use without consent. So just to emphasize again, these are owned and valued dogs. This owner will want to manage the breeding of his dogs, so the right ones are breeding, but he's unlikely to want to sterilize them all, and he must be given that choice. But when he exercises that choice, that reproduction control will contribute to maintaining herd immunity following mass vaccination, leading to improved rabies control and elimination, and indirectly saving people's lives. And in this particular context of the Serengeti, this can also contribute to protecting wild mammalian species who are also susceptible to rabies, such as lions and African painted wild dogs. I also think the challenge of dog and cat population management is growing in size. Such animals can thrive in urban areas, but they can also cause a lot of problems here. And urbanisation is on the rise, with over half of the human population living in cities now expected to rise to 68% by 2050. The photo on the left is of Dhaka city in Bangladesh, where I supported a dog population survey at the end of last year. We found only 3% of households own dogs. I was involved in a similar survey in Kathmandu, Nepal, where 30% of households owned dogs. But because Dhaka is so huge and densely populated, this represented 140,000 dogs, and 76% of these dogs were reported to roam freely for at least part of the day. And most had no access to vet care, including reproduction control, and this is a city that is set to expand far further. The photo on the right is one I took in Bangkok, home to 15 million people, and also expanding in size and density each year. The dog population is actually beginning to be brought under control, but we expect the cats will take their place and increasing numbers as competition over resources with dogs diminishes. And that's why I've been a trustee and supporter of ACC&D for many years, because they are working to advance non-surgical fertility control for dogs and cats. not by doing the important fundamental research that David Pepin and colleagues talked to us about at the symposium, but looking at all the potential barriers and opportunities for non-surgicals to ensure we can and will use them to best effect as they come to market. For example, I've already talked about the cat population model, which was used to answer several questions about how to use non-surgicals when managing cats. But ACC&D are also providing an important role as a trusted source of information in this field, as a leading and accessible objective voice through peer-reviewed publications, product profiles, and guidance. We are also working on changing the wording in those laws that govern what should be done with dogs and cats to ensure there are no unintended barriers to non-surgical use. For example, this law in Western Australia explicitly precludes non-surgical sterilants from being used because it states that a surgical procedure should be used. Whilst this language from the state of Georgia in the US is good as it contemplates some forms of non-surgicals, specifically Zuterine, however, it is a good example of problems that may arise when language is too specific and fails to contemplate future technology. We are also working on the practicalities of implementation. So I mentioned before the ear tips, notches and tags used in TNR and CNVR. Well, if we are using a non-surgical tool, then the animal will be awake and able to feel pain. So we have been working on how to permanently mark an animal in a painless way. On the left, you can see a microneedle patch with tiny dissolvable needles that can be applied painlessly to the skin to deliver a vaccine, or in our case, ink. So we have been testing this as an ear tattoo for dogs and cats, and you can see from the photos so far we found tattoos applied in this way seem to be staying put and are reasonably visible whilst not being overly obtrusive for an owner. So in summary, there is a global demand for dog and cat population management, and this is set to grow in our expanding cities. There are effective humane approaches, but reproduction control is at their core. Essentially, we are swapping population control via death with population control via prevention of birth. And many countries in the global south just do not have the capacity or resources to meet that surgical sterilisation demand. So the advent of non-surgical brings with it the potential to change this game for the better in these communities, and despite increasing demand, provide increasing benefits for animal welfare and human health. Finally, if you find the field of non-surgicals interesting, I recommend signing up to the ACC&D website, newsletter to keep abreast of relevant developments in this field. I've included the website addressed here, where you can find the sign-up link. Many thanks for listening to this presentation, and I hope you enjoy hearing news updates from ACC&D.